With the federal government still shut down, Governor Andy Beshear says supplemental nutrition assistance or SNAP money for November has not been cleared by the U.S. Department of Agriculture, bringing uncertainty for over 600,000 Kentuckians who rely on the program. God's Pantry Food Bank President and CEO Michael Halligan says the provider is prepared for now, but he has already started seeing the need grow from federal workers who are missing paychecks. He expects that demand to grow in the first few weeks of November.
We know that many of those individuals will turn to food pantry and meal programs for that assistance. What we don't know yet is how many of them, will need to seek assistance. But we know many will.
Halligan says their supply should be okay through the end of the year, but warned if the shutdown continues into the new year, they will be leaning harder on donors and food partners like grocery chains to meet demand. The governor also announced that the state will be covering the cost of the Temporary Assistance for Needy Families, or TANF program, in November, but likely cannot afford December. So, Representative Donworth, let's start with you here. Kentucky is not alone in this. How do you think the crunch on these support programs is ultimately going to be putting pressure on D.C. as they debate this shutdown?
It's a very complicated thing, and I think we've been preparing a little bit for this ever since the big ugly bill was passed, knowing that there were going to be changes to SNAP benefits and there was going to be more food insecurity. I think God's Pantry has done a really great job of preparing, as have other groups. I got a text from Ashley Smith from Black Soil that they are gearing up, that they are prepared to help people who are no longer receiving their SNAP benefits here locally. God's Pantry has been doing the work, working with them about budget requests to help them be able to expand their distribution capacities into eastern Kentucky. So this is, it is hurting right now, but this is a long-term problem that we've got to address.
Representative Moser, how do you think this could affect things in D.C.?
Well, I mean, it certainly is, and it should be, putting pressure on the legislators to pass a clean CR. We are now 4 weeks into a government shutdown where the government, or where the Democrats are essentially leveraging everything that we're seeing that is actually hurting Americans right now, whether it's not paying our law enforcement, our military, our air traffic controllers and other federal workers. It's affecting that sector as well as the individuals who are receiving benefits. And we have got to go ahead, pass a budget, make sure that the government is up and running, and then we can work out these additional deliberations or some of the proposals that are out there. But now's not a great time to add $1.5 trillion to the federal deficit, and that kind of spending, it needs to really be mitigated, and we've got to be, again, very intentional about the use of taxpayer dollars. So in Kentucky, we were all set to kind of handle this, and we were looking at ways to keep some of those systems afloat for our needy folks, neediest families. And now with the government shutdown, it's really, I think it's being problematic. It's very problematic.
I do, because our last segment was about Medicaid, and the Democrat stance on the shutdown in Washington is trying to protect the Affordable Care Act and making sure that people still have access to health insurance. We know that everybody is hurting right now. Federal workers, people who are traveling, obviously our SNAP recipients, everybody is hurting here. What we're trying to do is make sure that long-term we can address health affordability and accessibility. So there's got to be, I know there is pressure coming from both sides to find a solution, but I really encourage our lawmakers on both sides of the aisle to get it done, because people are hurting and we got to get it done.
And I know that both sides are sort of dug in on the perspectives on what D.C. can ultimately do. For state lawmakers here in Frankfort, are y'all's hands essentially tied in this? Is there anything that really can be done to help fill the need, especially considering we don't have a session until January 2026? Because of the federal nature, is there anything really that y'all can do?
technically the General Assembly doesn't exist until we come back in January. So legally we can't do anything. We can do the prep work to try to come up with solutions, but we can't enact anything until January comes. So right now trying to focus on the nonprofits and the organizations in our communities that can address some of these issues.
All right, y'all. Thanks for the good conversation.